Dr. John Brazier from Core Therapy. We've been talking about balance and different aspects of balance in the body. So what I'd like to do now, instead of focusing on a particular thing in balance, I want to focus on some conditions. So the first one I'm going to talk about is knee pain. So I've asked this little chap to come along so we can have a look at the knee and we can learn a little bit about the knee if we feel that's highly relevant to the pain that someone's suffering. The problem is, this is a very local issue. So if you've had an impact on your knee, then yes, we're going to get pain and we're going to get trauma. So we've got ligaments holding the knee together. So ligaments are holding the bones together and allowing the bones a little bit of movement, but it keeps the whole joint tight and strong. And then we've got numerous muscles, there's just one example, but numerous muscles around the system. So in terms of local muscles, we've got quadriceps that sit in front of the knee, and we've got hamstrings at the back, and we've got sartorius at the side and tensor fascia lata, and we've got influences below and influences above. But the question is, or the challenge is, if you go and see somebody about knee pain, is it actually knee pain or is it pain of my knee? Because the two are very different. A lot of therapists will potentially look at your knee and look at the muscles around your knee and massage you and try to get everything working. But what if it's a system problem, a system coming from different areas, other reflexes or imbalances that actually affect your knee? Because a knee is fairly simple in its action and what it does, but maybe there's an imbalance in your pelvis, in your spine, in your cranial system, in the muscles. How do we evaluate this? How do we understand it? But the idea is that the point is that a core therapist will look at you from your toes right up to your head, and from your head all the way back down to your toes again. So we implement specific muscle tests that challenge whether muscles are working. If the muscles are working, then don't need to worry about them. They're working. If they're not working, is it one muscle that's not working? Is it a muscle problem? Is it a nerve problem? Is it a lymph problem? Is it an associated bone or joint problem that's leading to the muscle being weak? So we have to go through a procedure of testing these things, which is all very, very quickly. These muscles can be tested in literally minutes. So you've got those local muscles around the knee, but then we've got reciprocal stuff going on as well. So, for example, the quadriceps that's at the front of the knee here and supporting the whole lower leg movement and knee position can be affected badly by the two bones at the top of your head. So if we test your quadricep power and both sides of your quadriceps, both legs are weak, one side could be 90% weak and the other side 70% weak. It doesn't have to be an equal weakness, but the 90% weakness could be leading to the knee pain on that side. When the client touches this point, this suture where the bones join, instantly, if that's the fault, both quadricep muscles will build up to 100% of power instantaneously. So we know exactly where the fault is. And if we know where the fault is, we know where we need to deliver our therapy. The other thing is that the psoas muscles in the lower back, if the lower back is misaligned, if it's not raised, if it's rotated slightly, then that's going to put pressure through the knee at the wrong angle, getting a twist on the bone, which will lead to wear and tear, which will give you pain. So the question is, was it a knee problem or is it a balance of the muscles in the lower back? So we know with the psoas, if it's one-sided psoas weakness, then we know we've got a problem in the middle of the spine around T11, T12. If it's both psoas muscles that are weak and allowing the pelvis to twist and rotate slightly, then we have to go up to C1 and look at the spine there. So we've got two areas of the spine that could lead to our knee pain. the gluteus maximus, your bottom muscles, the biggest, strongest muscles in the body, the most powerful, if they're not working, then you've got no support at all for the knees from the back of the body, because they're potent. They really lift and hold the body strong, so they hold you off your knees, so it stops heavy wear and tear onto the knees. So we know if there's two of those muscles not working, then we know it's a C2 problem. Or if there's one of the muscles wrong, then we know it's down in the lumbar vertebra, where around L3. So therapy has to be directed at that part of the spine to fix the knee problem. So we have to take a very strong holistic view of the body. We can't just jump at these sort of things. We can't just, oh, I have knee pain, so therefore we need to look at your knee. It really doesn't work like that. And often people don't just have knee pain. They have knee pain, they have a digestive fault, they're not sleeping so well, and they're fatigued. So when you take all of those symptoms as a whole, you have to look at all of the layers that could then lead to your knee pain. And this doesn't take long. It's not a difficult thing to do, but it's an understanding. It's an understanding of the greater system and not the micro system. This is just a micro system. Yes, your knee's going to hurt if you bash it. Yeah, but if you haven't bashed it, if you fell off a horse when you were 6, then you've been carrying that for 30 years with you, and now you get knee pain. But that knee pain is typically wear and tear from other things not supporting your knees in the action that we're doing. So in core, we have to make sure that the system is balanced and working.